Hello, my name is Diana Alvarado. I'm a doctor from Honduras. As Christine said, I have been joining medical mission teams with CHHF since around 2015. And I've always been a volunteer, and it's been really eye-opening even for me. I've always lived in Honduras. I was raised in Honduras, and then I went to medical school here in Honduras. And so I'm going to talk to you a little bit about our healthcare system and what it entails. So if you have questions, you can go ahead and ask whenever you want, or if you want in the end, we can also do that. And I'm also going to talk a little bit about my experience going to Limon in Honduras to this wonderful medical missions that we attend. So I'm going to go ahead and start sharing my screen so you can see my presentation. Let me see. I think, Christine, you need to allow me to share.
You should be okay.
Oh, there we go.
Okay.
Let me see.
There we go, Diana.
Yeah, can you see it? Okay. So let's see. There we go. So we're going to talk about healthcare in Honduras, public and private perspectives, basically. And the picture you can see there is actually a picture of our view in the clinic in Limon, Honduras, which is breathtaking. So let's get started. Okay, so I'm going to give you a little bit of an overview of Honduras. Honduras is a small country. We are located in Central America. We are right in the middle of Central America, as you can see there. The image above us in yellow is Mexico, and then we have the US above it. Honduras has a territory about 69,899 miles. Our capital is called Tegucigalpa, or Tegus for short and easier to remember. Our total population is about 10,593,798, of which about 50.7% are women and 49.3% are men, so about 50-50. And 47% of our population are younger than 18 years old. Most of our population resides in rural areas, 55.5%, and then the rest of the population, 44.5%, live in the urban areas. Our official language is Spanish. And another interesting fact is during 2023, the poverty index is currently 58%. What does this mean? To be poor is people who live with less than $6.85 a day, and extreme poverty are people who live with less than $2.15 US dollars in a day. So more than half of our population are in this category of either poor or extreme poverty. So as an introduction, our Honduras healthcare system has evolved over the decades. It has been marked by efforts to improve public health services and infrastructure. Historically, the system has faced challenges due to economic constraints, political instability, and natural disasters. And mainly in this last years, it has been political instability, the COVID-19 pandemic, and natural disasters, because we had some pretty severe hurricanes a couple of years ago, which have been devastating to specifically the rural areas in the country. Our healthcare system components are basically divided into public and private sector. So a quick overview is the public sector is primarily funded by the government, and it aims to provide basic health services to the majority of the population, especially those in the rural and underserved areas. It includes a network of public hospitals and clinics. And then we have the private sector, which consists of private hospitals and clinics, and they offer healthcare services often at a higher standard and higher cost. These services are basically utilized by individuals who have higher incomes or those who have private healthcare insurance, which is not many people. The public healthcare structure, we're going to talk mainly about this structure because it serves most of the population. So it consists of basically 4 parts. The public healthcare system consists of the health ministry, which is called CESAL by its abbreviation in Spanish. It offers attention in its own facilities and with their own doctors and nurses, and it's estimated to serve about 60% of the total population on a regular basis. So this is our main healthcare system. Then we have the Honduran Institute of Social Security, called ICE by its abbreviation in Spanish, and it covers about 40% of the formally employed population and their dependents, which include their spouses and children under 11 years old. This accounts for 18% of the total population of Hondurans, and they offer attention in their own private institutions as well, belonging to the Ministry of Labor and Social Security of Honduras. They collect and administer the mandatory fiscal funds from workers and employers. So that is how they fund the hospitals they own. Then we have the Ministry of Defense, which has health institutions like the military hospital. And lastly, we have the Honduran Institute for Children and Families, which contributes to healthcare system through programs for childcare, nutritional attention, and some activities for early stimulation and attention for children and teenagers with disabilities. So we're going to talk a little bit about the main areas of the public health care, which is the health ministry, which has 2 levels of attention. They have a primary level of attention, and this consists of rural healthcare centers, which are called CESAR. They are about 436 in Honduras, and they sometimes have doctors, not always, but they usually have a nurse. And then we have Sesamo, which are healthcare centers, which have doctors and a dentist. And we have about 1,078 of those in our country. Then there's a secondary attention level in the health ministry, which has 29 hospitals, and they are classified as national hospitals, regional hospitals, and area hospitals. Most of these hospitals were built in the 1980s. Just a couple of them, like 3 of them, have been remodeled since. Some of them have certain areas which have been remodeled, but most of them remain with their original infrastructure. So you can imagine how they appear on the inside. On the images we have here, you can see our typical primary attention level centers, which are the healthcare centers. This is basically what they look like. They are small, they are understaffed. You can see a long line of people, of women in this case, waiting outside. Sometimes they have a doctor, as I was telling you. Sometimes they only have a nurse. Sometimes they have neither. Because of the areas they are located in, sometimes it's hard to reach for the nurses that are hired, or sometimes even because of the roads and the weather. It depends, but they're not functioning like every day of the week, or not even like business days. So this varies a lot. Then we have national hospitals in Honduras, which are also part of the Ministry of Health. And we have 3 main public health institutions, which are located in 2 of our major cities. We have Hospital Escuela, which is located in the capital, Tegucigalpa, which is on the picture on the bottom left. Then we have Hospital Mario Catarino Rivas, which is located in San Pedro Sula, which is another major city. The picture is on the middle. And then we have ICE, which is part of the Honduran Institute of Social Security, and that's on the far right. So if you see these hospitals on the outside, well, they seem like, like okay hospitals, like regular hospitals, which would, you would assume that they would have like good attention. We're going to see some pictures of what they actually look on the inside, and we're going to talk about some of the major challenges these institutions face. So mainly the location of these hospitals which are only in the main cities of Honduras. That's one of the major challenges. And then the limited number of institutions. As you recall, I mentioned they are only 3. There are 3 main hospitals, which include, the major specialties and subspecialties, and they are basically insufficient for coverage, and they are not able to keep up with the volume because they receive referrals from all of Honduras, which include the 18 Honduran departments. So on this picture, on this slide, you can see a typical day in any of these 3 major hospitals. You see a crowded room, you see both male and female. You even see on the background, there's medical staff doing rounds where they're attending in the middle of the chaos. So this is basically what it comes to for the main institutions, the healthcare institutions in Honduras. Hospital Escuela, which is the main hospital in Honduras, serves patients who arrive directly to the hospital, and they serve also referrals from other healthcare institutions of the country because it has specialty and subspecialty services which aren't available in other public hospitals. And the Hospital Escuela receives about 84% of all of our country's referrals. This is an image of the ER in Hospital Escuela. As you can see, it's not like very well conditioned. There's not even like a cubicle for each one of the patients. Most of them are just waiting for hours and hours. Some of them have their files or even the referrals, like this guy you see on the corner has his referral on his bed and just waiting to even be evaluated. Another challenge is the lack of the government-sourced ambulances. It is estimated that about 50.9% of referrals are actually transported using their own resources. So in this picture I put here, this is an image of the new triage entrance at Hospital Escuela, which was built after 2020. So this is a new area, and you see 3 ambulances there. However, most of the referrals, more than half of the referrals from all over the country, actually have to look for their own way to be transported to one of these main hospitals. And we have seen this in Limón during our medical missions. We have had to refer patients because of several conditions, sometimes even emergencies. And most of the time we have to look for ways and to see, support from the community, support from neighbors, support from even the mayor of the city for them to be transported to the major hospital. So that is another one of the major challenges we face in our healthcare system. And then we have the Honduran Institute of Social Security, which covers about 18% of the Honduran population and 40% of the formally employed population and their dependents, as we were talking about. Those people who are not formally employed usually they have no other choice but to use the health ministry hospitals. So the people who are formally employed pay like monthly, their employers and themselves, part of their salary goes to a fee to pay for this service and this right for health, for health issues. Even if they have a cold or something, they're able to go to this hospitals institutes to be evaluated. And if they need time off, they need a leave from their job, this is where they go to get it. However, during the 2010 and 2010 through 2014 administration, was responsible for embezzlement of $266 million, which were used for overvalued contracts, agreement payments to ghost companies, tax evasion, and illegal financial transactions. So you can see this a lot of money, instead of being used to cover expenses for the population and for this formally employed population and the medical staff and medicines, it was used elsewhere and basically just stolen. On the image here on this slide, you can see some of the medical staff protesting during this time because of the consequences this has led to. So currently, the state of the Honduran Institute of Social Security is a state of calamity and scarcity of medicine for the rightful patients who now have to pay out of pocket despite paying for a monthly fee to access this service. On this image, you can see on the right, this was actually October of this year, last month. Those are the long lines you can see outside of their institutions of people waiting to be evaluated for different healthcare reasons. And most of the time, there's not even the medicine they need. During the administration I was talking to you about, there was talks that the medicine didn't work. People were taking the medicine that they were given in the institutions, and the medicine wasn't working. And once they started testing for this medicine, they realized a lot of them were actually not good, or they were even flour. So people weren't actually given the medicine they needed, and they weren't even told that they didn't have medicine for them to go find it themselves or fund it themselves, but they were actually being, like tricked into taking medicine that wasn't real. The other picture on the left is a picture of the institutions that belong to the Honduran Institute of Social Security, and this is basically what they look like patients waiting outside, waiting for a room, because there are not enough hospital beds in the country. So while the public health care is more accessible financially, because in theory, there's just a small fee they have to pay, there are significant disparities in the healthcare access and the quality, especially quality in the laboratories, in the medicine they get, in the imaging services. Sometimes there's not even working machinery anymore in the public healthcare, and also the staff volume. Staff is usually not enough, and even when there is enough staff, there are severe issues in payment. Most of the medical staff and all of the staff, actually, the hospital staff, this includes medical doctors, nurses, cleaning people, cleaning staff, are not paid on time. So a lot of the times they end up going into strike to force the government and the Ministry of Health to actually give them their salaries. So in all of the health ministry, we have in the public health care, we have about 7,000 beds in total, and that does not even account for 1 bed per 1,000 persons in our country. And then a little bit about the private healthcare. The private sector offers healthcare services, often at a higher standard and obviously higher cost. These services are primarily used by individuals with higher incomes or those individuals who have private health insurance. Currently in our country, we have 12 insurance companies. The health insurance varies depending on the age, depending on health, depending on the coverage you want, if you wanted to cover just Honduras or international as well. And the private healthcare counts with about 1,300 establishments, and it includes medical centers, clinics, laboratories, pharmacies, and medical offices. And in total, the private healthcare in Honduras counts with just 575 hospital beds. On this picture, on this slide, you can see one of the main hospitals, private hospitals, located in Tegucigalpa, which is called Honduras Medical Center. You can see it's a nice hospital. It has enough parking space. It's located in a safe area in Honduras, but this doesn't even cover for 10% of the population. And even if it could cover for more of our population, as I told you, more than half of our population is in a poor state or in extreme poverty. So they are not able to access this type of healthcare. So now I'm gonna talk to you a little bit about my experience of going to this medical missions in Limon. If you are coming or you're thinking of coming to Limon, I'm gonna mention a little bit of what it's like. And so first of all, I have a picture of the beautiful view there is in Limon. The beaches are amazing. The sunsets are lonely. lonely beaches and beautiful sunsets. The roads, as you can see in the middle picture, are tricky in part of the way, not all of the way. And the views are absolutely breathtaking. This is Piedra Blanca, which is one of the locations we usually go to serve as clinic. And then some of the takeaway messages I have had during this year's working as a volunteer for this medical missions is that any type of support that you give the mission goes a long way. On one of the images, we have one of our team members who came. She's a lady who came. She was retired, and she came and she was ready to entertain the kids as they were waiting outside hours and hours in the heat for medical attention. And even if it's just entertaining the kids, this helps a lot. And then we have an image of a pulmonologist. That's actually my dad. I convinced him to go after several years with me, and he absolutely loved the experience. Serving children who have asthma and adults who have asthma who haven't seen a pulmonologist like ever in their lives, or it's very difficult for them to access to a pulmonologist because there's usually none in the main hospitals, or at least not for like an outpatient consultation. Another one of my take-home messages during these years have been that the teams, we give to different locations, and this makes the experiences much more interesting and fun. This was our team during the August 2023, the Morgans team, which was really fun. That was Piedra Blanca. You can see on the right, there's the yellow bus, which we travel in, which is also really fun. And we have received people from all career fields, and they are all absolutely helpful. You can see on the right, we have an image of the staff of the team in August. And no, actually, I think that was a couple of years ago, 2021. That was the pharmacy. We were working at a pharmacy, and there you can see there's doctors, there's a chef, there's nurses, there's all sorts of fields, and everyone just comes together and works for 7 days, 10 days, and it's absolutely amazing what we can achieve, and the difference that we actually make for a small part of our population in Honduras. And then CHF has great staff and support, and they take amazing care of each team. We have the cooks who are amazing, not just because I like Honduran food. Other team members can talk to you about how we usually gain at least 5 pounds whenever we go to the missions. They take really good care of us. They're loving. And then we have David Kelly, who has been part of the staff for many years. He usually drives. He's an expert driver in the harsh roads that we go through. And then, well, each mission is a growing experience. I remember this family we have here, this woman, when she finally got to the clinic we were serving at, she told us that she had walked with all of those kids for 2 hours in order to get attention. So it gives you perspective on how important it is, even if they just get vitamins, even if they just get, acetaminophen for the baby who had fever, it goes a long way for them. And then the picture on the right is a picture of 3 siblings who were wearing their rubber boots because it was really rainy and muddy. So you can see they go a long way just to be able to get any form of medical attention. So it's an amazing job, the one that the trips actually perform. And also that no two teams or trips are the same, and they are all amazing. After each trip, I meditate on how different I feel like I come back, because you learn so much from the different personalities. You have so much fun. You meet so many people, and it's amazing just working with the teams. And lastly, we're going to talk about some of the common health issues we see when we go to Limon. So if you're thinking on coming, this is basically what you're going to see. A lot of hypertension. In Honduras, we have about 22.2% of the men who have hypertension, and 20.2% of women who have high blood pressure. So we see a lot of that in the clinic. A lot of people come for a refill of their medication, which they are already on. So we are, just following up on treating hypertension. Then 5 to 10% of the population in all of Honduras has diabetes. A lot of the population that we received during the teams is also looking for their diabetes medication. Then heart failure, which is the #1 cause of hospitalization in older than 65 years old in Honduras. Then we see a lot of pulmonary issues, especially asthma, COPD, because of people, not only because they have been smokers, but a large part of it is because they have cooked over the fire with wood, for so many years. So they end up with COPD. And then TB, tuberculosis, is also part of the issue. Honduras has a lot of tuberculosis, and so we have to keep an eye out on people with symptoms of tuberculosis. And then for our children and pediatric population, we see a lot of nutritional deficiencies, especially iron deficiencies in younger than 5-year-olds and those children who are breastfed or are still not able to eat as much. One of the benefits of the population in Limon is that they have the sea, so they fish a lot. So nutritional deficiencies aren't as marked as other parts of the country. Also, we treat a lot of parasitic infections. And when we have a dentist, which is not very often, when we have dentists come to Honduras, they usually work for the longest during our work days. And then we give a lot of prenatal care. We give out birth control as well to those who wish to receive birth control. There's an image there of one of the pregnant ladies that we have seen. It's not often, but there have been births in the clinic in Limon. We're always ready for that, but it's not common. And then we usually do wellness checks for babies and pediatric population. And then we see a lot of lice. You have to keep an eye out for lice, for scabies and impetigo whenever they get a little bit more complicated. The good thing about all of the health issues that we encounter in Limon is that we usually have a very complete pharmacy. And if we don't have what we need specifically, then we figure it out. We work together with the pharmacist or with the other doctors, and we figure out what it is we could give instead of what we're exactly looking for. But there's usually more than enough, and there's usually what we need to cover for all the health issues. And a small percent of trauma, sometimes we see some trauma, not very severe. If there's any severe trauma, then we try to stabilize and refer. But we have the basics to cover for, sutures and stuff like that, and to stabilize patients with trauma. And then that's about it. If there's questions, I'm more than glad to answer.